Hello, how you doing there? My name is Jamare. I'm your nurse today, and I'll be doing a head-to-toe physical assessment on you. At this moment, you have the right to refuse. If you have any questions, just let me know. This information we'll be doing, anything we'll be doing, will be a confidentiality. So, do you have any questions?
No, sir.
Right now, I'm about to start a facial inspection. I am inspecting the head, making sure that the hair follicles are intact. The cranial is intact, no lesions or knots located. Inspecting the face, making sure that it's symmetrical. The eyes are symmetrical, the nose is symmetrical, and the mouth is symmetrical. Just making sure that the client has facial expression. Then I'm going to palpate the temporal arteries. The temporal arteries are 2+ strong. Palpate the jawbone. Can you open mouth, please?
Uh,
Close it. Open. Close it. Opening and closing the mouth, I did not feel any crevice or anything like that. So there's a normal function with the jaw. I'm gonna ask for you to clench down on your teeth. Normal resistance when clenching down on the teeth was no problem. I'm going to tell you. I want you to close your eyes for me. Tell me when you feel this on your face.
I feel it. I feel it.
Sensitivity with the cotton wisp is normal. I'm going to work on cranial nerve 7. I'd like for you to smile for me, frown, close your eyes, lift your eyebrows up, show your teeth, and puff out your cheeks. All right, since I got my client standing up, we're going to use the Snelling chart to test the visual of the client. I'd like for you to cover your left eye, please. Read the lowest line, read line number 7.
DEFPOTEC.
All right, cover your left right eye and read line number 7.
DEPTOCE.
All right, with both eyes, read line number 7.
DEFPOTCE.
All righty then. At this time, my client has 20/20 vision. We'd like for you to sit back down on the table, please. Next, I'll be inspecting the ocular movement of the eyes. The ocular movement. So I'd like for you to look at my finger. That is the 6 points of the ocular movement. And now we're going to assess the eyes, making sure that it have an equal reaction to light. Just look straight ahead for me. The eyes are constricted normal without any reaction, and it was no sluggish at the area. I want you to focus on my finger. Look at the wall. Focus on my finger. Look at the wall. The client's focus on near object and far object is normal. I'm going to inspect the eyebrows, which are symmetrical, the eyelashes, which are pushed out in front of the face, which is normal, and the sclera. The sclera is white, and the conjunctivitis is pink without any drainage. The cornea is clear, and the iris is round and flat. I'm going to inspect my client ears just to make sure that there is no lesions or anything abnormality on the ear. The ear is symmetrical, and now I'm about to perform a whisper test. Whatever you hear, just repeat it for me.
Dog. Cat.
Now I'm about to inspect my client's nose, just making sure that everything is symmetrical and it's at its appropriate spot. I'd like for you to close one nostril for me, please. Take a deep breath in and blow out. The other one and blow out. About to palpitate the frontal sinus. Palpitating the frontal sinus. Do you feel any tenderness?
No, sir.
I'm about to palpitate the maxillary of the face. The maxillary of the face. Do you feel any sinus?
No, sir.
Any tenderness, I mean?
No, sir.
Okay. Then I'm about to inspect the mouth. Just to make sure that I don't see any lesions. Open up your mouth. The tongue is pink with no lesions. The mucous membrane is pink and moist without no problems. All the teeth is intact and there is no cavities. Looking at the tonsils, there is no tonsils are visible. I'm going to put this in your mouth. This might make you gag for a second. I'd like for you to say ah. And the client has a gag reflex that's intact. Will you stick out your tongue for me, please? The tongue is symmetrical without any lesion. Now we're about to assess the client. Neck. Just making sure that everything is intact without any problems. There is no bruising, lumps, or discomfort with the skin. No rashes. First, we're going to palpitate the preauricular, which is in front of the ear. These are lip nodes that I'm palpitating. Front of the ears. Palpitate behind the ears, which is postlicular. Behind the neck is occipital, palpitating the lip nodes. Then up under the chin is the submental. Behind the jaw, some lip nodes are there, which is the submandibular behind the jaw. Down towards the neck is the tonsils. Lip nodes, it's intact. No inflammation. Are any of these tender or hurting to you, ma'am?
No, sir.
Great. So posterior of the back, lip nodes, is any tenderness?
No, sir.
The deep cervical chain, run your finger down the neck and the subclavicle area. Do you feel any problems?
No, sir.
Range of motion test. I would like for you to chin down to your face. Look side to side. Shoulder to ear. Hyperextend. Now I'm about to palpate your thyroid, making sure that your thyroid is intact and your thymus. Once your thyroid and your throat is no problem. Can you swallow for me? Freely move without any complication. Palpitate the carotid artery. 2+ strong. The right side, 2+ strong. Now I'm going to listen to it with my bell, making sure we don't hear any bruits. Normal as it is with no bruits, only a whisk. I'm about to assess the posterior and the lateral side of the back. I'm about to palpitate and inspect the skin, making sure that there is no bruising or lumps or anything of that nature. I'm going to lift your shirt just a little bit. Just making sure that I don't feel any lumps or bruising. I don't feel anything. Then I'm going to make sure, can you say 99?
99.
99?
99.
99?
99.
99.
99.
There was no tactile femurs, and it was no vibration. Then I'm going to place my hand on the back to feel expansion. Take a deep breath in. Deep breath in. Deep breath in. Equal expansion of the back. There was no problems within breathing. I'm going to check out the costal vertebrae angle, castral vertebral angle. Going to pound to make sure, percuss, to make sure that it do not feel any tenderness. Any tenderness at that area?
No, sir.
Everything was in normal limits. Then going to auscultate the back of the lungs and the lateral side. Deep breath in. 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 All right. I'm going to listen to your side. Deep breath in. Deep breath in. Deep breath in. Deep breath in. Bilateral breath sounds are equal in expansion and it's clear. I'm about to inspect the upper extremities. Just making sure that there is symmetrical intact. There is no bumps or lesions or any bruises on the skin. I'm about to palpitate the brachial pulse, 2 plus strong. Palpitate the radial pulse, 2 plus strong. Palpitate the ulnar pulse, 2 plus strong. Check capillary refill in both fingers. Less than 3 seconds. Less than 3 seconds. Now we're about to do some range of motions. I would like for you to extend your arms out, flex them over your head, behind your back, bring them out forward, abduct away, adduct in. Now I'd like for you to extend your elbows like this. That is called flexion and extension. Then I'd like for you to pronate your hand, palms towards the floor. Pronate, subnate, and flex your arms up for me, please. Normal against resistance. Then we're going to do range of motion of the wrist. I'd like for you to stick out your hand and hyperextend your wrist. Make a fist. Open your hands. Spread your fingers. Then touch each finger. Then I'm going to need for you to keep your hands out. Touch your finger to your nose. Other finger to your nose. I'm going to do something called graphothesis. She has to tell me what I draw in her hand. Close your eyes for me, please. What number is that?
7.
What number is that?
8.
I'm going to place 2 objects in her hand. She has to tell me identify which one they are. Close your eyes. Keep them tight. Tell me what this is.
A pen.
And this right here.
Cotton swab.
Then I'm about to assess the brachial reflex. As I'm doing this, the brachial will flex. Good, correct. Great. That's called the brachial. Now I'm going to do the triceps. Just relax your arm for me, please. Great. Great. Both brachial and tricep reflex are intact. 2+ strong. Then I'm going to work with the finger. It's called the bicep and triceps are 2+ strong. The brachial, what to do next? You see the hand will move once I hit. Just relax for me, please. 2+ strong without any problems. Now I'm about to inspect the anterior of the chest, making sure that there is no bruising, bumps, or rashes. Pulling up the client shirt to expose the skin, make sure to keep privacy intact. Inspecting the anterior of the chest, there is nothing there to be noted. Take a deep breath in. The chest rises and falls symmetrically. PMI. It's pulsating with no heaves or thrills. I am auscultating the aortic, the mitral valve, and the tricuspid valve are great. The S1 or S2, no murmurs, and everything was regular. I'm about to inspect the atom of the skin, making sure everything is contour and symmetrically intact and visible. You have to inspect, auscultate, percuss, and palpate. So I'm inspecting, just feeling around. I inspect if I see no hernias. I'm about to listen to the bowel sound in 4 quads. Bowel sound is active in all 4 areas. I auscultate the aortic, which is no bruits, and the art, no bruits. Now I'm about to auscultate the renal arteries using my bell. Then I'm going to percuss with my hammer. Do you feel any tenderness?
No, sir.
Then I'm going to palpitate each quad with a light palpitation. Then I'm going to use a deep palpitation. Then I'm going to deep palpitate for the right side of the liver. Are you feeling any tenderness?
No.
Great. Now we're about to inspect the lower extremities of the body, making sure that each of the extremity is just linked and the same. I do not see any edema in the lower legs at all. Inspecting the skin of the legs, there is no bruises, lesions, or knots at the moment. I'm going to assess for the popliteal palpitate 2+ strong, which is behind the knee 2+ strong. Posterior tibials 2+ strong, and dorsal pedicus of the feet 2+ strong. I want to ask you to follow some commands. I'd like for you to stick your feet 90 degrees up in the air. Are you okay? 90 degrees up, come up closer. Then hyperextend back down. Knees to chest. Rotate your hips with one leg. Push back down, feet straight out. Rotate, put one leg down. Rotate one, bring one knee across your chest, outward, back down. Other knee across your chest, outward, back down. I'm have you to invert your feet inwards, outwards. Then I'm going to, can you push against my hand? Strong, pull back, strong. Feet and push are great. Now, we're going to ask you while you're laying down to work the opposite of your foot to your leg. Rub the opposite of the foot to your leg up. The cerebellum function is intact. I'm going to get you to sit on the side of the bed for me. I'm going to check the reflex of the leg, making sure that the reflex are strong. Just relax for me. Reflex is 2+ is intact. Reflex is 2+ is intact. The patella. The tendon behind the leg, the Achilles, the feet's going to flex upward just slightly. 2+ is intact. 2+ is intact. We're going to do the Bombisky, rubbing the bottom of the feet or the sole. The feet will expand out. It's ticklish. Alrighty. I ask for you to stand on one, hop on one leg, hop on the next leg. Can you walk on your tippy toes? Can you walk on your tippy toes? Now walk back towards me. Now walk on the bottom of your heels. Just walk on your heels just like this. All right, now I want to stick your arm out in front of me. Close your eyes. There is no swaying in the run buzz test. I'm going to inspect your spinal. Can you bend over for me? Expecting the spinal is intact and there is no, the spinal is intact in midline. Now at this time, I'd like for you to look at me, please. Bend forward, touch your toes, bend, stand up, bend side to side, then bend backwards. Are you okay? Bend backwards for me. The kind is off balance just a little bit. At this moment, I'd like to thank you for watching my video. My name is Jamare, and this is my head to toe assessment. Thank you.